Okay, good afternoon, everybody. Let's take up some of these ones where somebody else is waiting for us. House Bill 15.
House Bill 15 is the invasive and native plants classification, listing, and use. It initially had a sales and use tax exemption for buying native plants here in the state of Maryland. The Senate struck that provision in the Senate bill. The House did the same thing, struck the sales and use tax exemption. So now it is just dealing with the listing and classification of invasive and native plants in Maryland. EAG has voted it. EAG is primary, they voted, and now it's in front of you. B&T
Second.
passed it.
All's in favor? Opposed? Okay, how about 855?
855, similar situation. The B&T passed Senate Bill 942, which I believe was Senator Griffith's bill, and this was going to create a urban agricultural water and power infrastructure grant program and fund. EAG has put the bill in the same exact posture as SB 942, which already passed the committee.
Mr. Chairman, I have reached out to the Rules Committee 3 or 4 times. I've reached out to Environment and Transportations. Senate Bill 942 has not yet had any activity whatsoever. I'm looking it up right now, but it's an important bill, but
That's right.
they're both important.
I move we hold it.
Okay. Tell them to move the Senate bill.
I've asked. I have a thread of messages.
So
Let me
it's
turn
the
it-
will of the committee to hold this right now? Okay,
Hey, hug it.
hug it. Senator Eckert, did you, excellent. 1196.
Uh, 1196 is a tax sale bill that would give local governments a little more authority to withhold properties from tax sale. Senator Eckert, I don't know if you want to.
Thank you very much. Mr. Chairman, this does a number of things. It allows an entity jurisdiction to withhold from tax sale owner-occupied residential properties. May also withhold the tax sale if, for any residential or nonprofit organization properties, if the property's in a payment plan, and if it's withheld, the county or that municipality has to pay the property taxes. There are a couple of other provisions. The county or municipality may cancel or postpone a tax sale in the event of emergency, and the governor or another governing body can do that. I think we're accepting what the House put in, but then are going to add some other language that they may be withheld from tax sale, any residential or nonprofit organizations, if the local municipality or government determines eligible criteria.
Yeah, so on page 2, the House, there was an existing provision that would allow owner-occupied residential property to be withheld from sale. It was a 2-year window meant to deal with the pandemic. The bill, as it came over from the House, makes that permanent. However, when you look at all the other provisions for authority to withhold property, it's either clear what the criteria is or the provisions in law. As you'll see on page 3, line 13, and line 30, and then page 4, line 15, there's references that the property needs to meet objective criteria established by the local governing body. So the amendment for your consideration on page 2 would be to just tack on at the end, so may withhold from sale owner-occupied residential property that meets objective criteria established by the governing body of the county or municipal corporation. That way the process is transparent, and so when they elect to exercise that authority, they would be setting up the process for how that would work.
So I would move favorable with the amendment.
You are our expert.
Second.
All those in favor?
Aye.
Opposed? Okay.
I've got it.
Yes, you do. Okay. 1208. Let's hear about that. 1208? Oh. Oh, yeah, I see.
1208, you all are primary, EHE is secondary. The bill, the provision of the bill that is B&T's jurisdiction is that it's creating a preceptor tax credit for, it's for nurses. It's advanced practice nurses, licensed, advanced practice registered nurses, licensed practical nurses, and registered nurses. There's federal money that's assumed to be the source for the tax credit. It works just like the preceptor programs for physicians and the physician assistants. It's for when these practitioners are serving as a preceptor without compensation to help in underserved areas to help train new staff. The other pieces of the bill that are within the jurisdiction of EHE would be requiring the Board of Nursing to engage in activities to expand workforce expansion and apprenticeship.
You
And
just
then-
got Senator Rosethev's vote.
And then there's also a uncodified language establishing a stakeholder work group about how the state can implement loan repayment assistance programs for nurses and other practitioners. So
Okay. What was the bill on this? Price?
the fiscal note, it was relying on federal funds. The other aspects of the fiscal note are related to additional staffing efforts for the Board of Nursing. But the tax credit is capped, like the other ones, at $100,000 a year. It's a first come, first served. The maximum an individual can receive, I believe, is $10,000 in a taxable year. And it's assumed that federal funds will be available to cover the costs for the tax credit.
Is that accurate?
I don't know how the Board of Nursing is going to do it without additional staff, quite honestly. I think everybody was in favor of the bill. That tax credit that we set up was because there are specifically identified preceptors for NPs, PAs, and physicians. It's a formalized relationship, and there is no such formalized relationship already established for those other categories. There's clinical supervision, but it's not on a 1-to-1 or a 1-to-5 like, I just don't know how they're gonna do that, but if they want it, I guess they'll have to figure it out.
Okay. Senator Roosevelt?
Yeah, I just had a question. I should remember this from EHE. Who do preceptors work for? Who are their employers?
A preceptor would be like a physician who's already in practice, and in order to complete that final leg of your education, that clinical, you have to have that agreement with that preceptor. So like a doc or a nurse practitioner,
So you, the individual.
you, the individual, so the individual qualifies for the tax credit. And when folks brought me this, I wasn't sure how they would do that, because when we did that preceptor tax credit, It was for the preceptor.
And this is not for the preceptor, this is for the student, apprentice, whatever? Maybe this is a question for Philip. Who gets the
Who
money?
gets the tax
preceptor.
credit?
Meaning the supervisor,
Yes,
the supervisor, not the supervisee.
right. The
That's
person,
clear.
who- yeah, it's already it's already a licensed practitioner.
Okay, thank you. Thank you.
There
I just
were,
don't know how it's going to work.
in the Board of Nursing's testimony they submitted, there were two areas where they suggested amendments, although these arguably are more in EHE's jurisdiction. I don't know if you want me to raise those.
Let me go back to it does provide for additional staff.
The note is assuming additional expenditures from the Board of Nursing for the additional staffing efforts related to the workforce development components of the bill.
And how do the federal funds come in?
According to the note, there's federal funds that can be used for the tax credit,
Okay. That's,
to the extent they're not available, then the special fund would, or the general fund would have to provide for that.
so Senator Eckert, you comfortable enough with this?
I wasn't comfortable with, it's a good initiative if we're going to do it. I think we need to provide, include the amendments from the Board of Nursing.
And what are they?
There are a whole,
So-
go ahead, Phil, thank you.
The first one they noted is on page 7, lines 26 through 28. There's a requirement that would have the board adopt regulations establishing standards for online provision of all aspects of nursing assistant training programs that meet the requirements established by the board. The piece that the Board of Nursing submitted a proposed amendment on is the word all aspects. They would prefer that to be, strike that and say didactic. The reasoning being is that, I guess, during the pandemic, lab and other components of the education were allowed to be online during the emergency, but with the federal emergency being lifted, the the simulated labs are no longer, I think, considered part of their approved curriculum. The other change they suggested is on page 8, lines 13 through 18. This is a provision that requires the board to approve the use of a nursing assistant training site by a program within 14 days after the program applies for approval. If they've been previously approved to use the training site, the Board of Nursing noted that sometimes it can take up to a month to do those reviews and approvals, and they proposed striking that provision.
This is all an effort. We'd been working in the interim to be able to expedite CNA, which is basic entry level, into nursing. We had a CNA, GNA bill, but this is all part of that, making sure it's available. We were not able to get people credentialed because of having inadequate sites. So that's why this would allow them to go ahead and improve the training sites, like in conjunction with community colleges.
Oh, my goodness. We just don't know enough about, we just don't have the depth of knowledge of what you're talking
Oh,
about. I mean,
I'm
it's-
sorry.
I
Do you want
didn't-
me to explain anymore? Can I?
No,
just-
I mean, I know, look, I mean, you obviously have a up-close knowledge of all of this stuff.
Yeah, in order to do CNA training, you have a theory component, which is the didactic, and then you have a clinical component, which is the hands-on. So you have to be supervised to make sure that you're able to be proficient in some of the basic skills in basic nursing, and that's what this is setting up. And we just haven't had enough clinical sites, and we have not had enough supervisors to be able to do it, if you will. So I think they're thinking that probably to provide that kind of a tax credit would be helpful to those individuals. But there are so many aspects. I mean, there's CNA.
When you said tax credit, I understood that part.
Yeah. Now, were we primary on this?
Second, yes,
You are primary.
we are primary on this,
Okay.
which is confusing to me in and of itself.
Yes.
Why we were primary on
Yes,
this.
that's,
It should have been the other way around.
yes, it should have been. I would
That's, I
agree
guess
with
that's
that.
really the fundamental issue here. Look, I think all of these are really, I mean, we've done the preceptors before, we've done the LARP stuff, all of this stuff is really important in our day and age right now. There's no question about it. I just, and want to get it right. But what's the totality of the package, if you will, to get it all right? And I don't know that we're doing that in that as thoughtful as I would like to, but quite frankly, we only have a couple more days, and sometimes we just got to do stuff because we got to do the best that we can. Senator Griffith?
Thank you, Mr. Chairman. I guess I'm not sure if we have the amendment we're referencing, but Senator, if you could just say, as amended, this bill would do this, because I understand, I think what the bill did as introduced, I'm just not hearing the difference or what it is that the amendments that you're presenting are going to do differently.
And I'd have to go back and review that a little bit more, because I was actually not prepared to speak on the bill today. I'm sorry.
I mean, I got word from the sponsor that they thought this was pretty critical and involved a good chunk of individuals who are waiting on this to make things move forward. And I'm concerned about that because I don't, like I said, we all know how much the necessity is out there right now.
And Delegate Kelly has spent a lot of time with the Board of Nursing on this.
Yeah.
I have not spent a lot of time on this,
Right.
understanding it.
I understand. I tell you what, can we
Can we
maybe
go
we don't
overnight?
amend it and we tell we'll send a message to EHE that it's really, that sounds a lot more in their purview. But from our standpoint, we're good with it as, from a tax perspective, we're good with it. Is that in part with what you're, consistent with your saying, Senator Griffith?
Yes, it is, Mr. Chair.
Can you live with
Could
that?
I have an overnight with it, or is it going to be too late?
I guess since they would only have to concur, there's no
This is the only bill, isn't it?
Senate match.
Yeah,
There's no crossfire.
there's no cross-file.
Yeah, it should be able to get done,
Okay, thank you.
but maybe, I don't know who it is that would be working this particularly over at EHE. Maybe you have a conversation with them. No?
I'm not sure.
Okay.
It's complicated, and it's complicated
It sounds like
because
it's a little complicated.
I've
I
had a lot
agree.
of discussions with the nurses who wanted the tax credit. And I don't understand, with all due respect, how it's really going to work in reality. Because there are no defined preceptors. So how do you define preceptor in the bill? You know, that's the
Isn't
one
that in law
issue.
somewhere else? Because we've defined it before in bills that I know you've done.
Correct, but the preceptor in the other bills have a definite role, and it's a clinical definition, if you will. For LPNs, for RNs, for CNA, there is no preceptor, official preceptor relationship. It's a nursing supervisor or an instructor. So it's different. There's more autonomy, if you will, with the preceptor relationship with the upper level clinician than there is with the lower level nursing clinicians. There's more supervision, observation, being right there with the individual. In a preceptor, it's just a different relationship.
Okay. All right, I think we can get by
We
with
make a
another
couple
day.
of phone calls, thank you.
Yeah, yep. Okay. Okay. All right, let's try to tackle this 632. Senator McCrae's done a little bit of research on this.
Mr. Chair, I was able to reach out to MDOT to understand the issues with this piece of it. Obviously, they sent the email to all of us. They talked about the east-west corridor study that they're currently doing. I believe that they have 12 million wrapped up into the study that they have put forward. The challenge that we have in front of us is that there was an important conversation about rail going on, and I think that that is the core of what the House sponsor with House Bill 632 was trying its best to get to, is the rail piece of it. It's not that the study is not taking place, whether it's bus rapid transit or other modes of transportation. It was the rail piece of it. And if we do move forward, if we don't, I get it. If we do move forward, there was an issue from Baltimore County wrapping them up in it to just make sure that that line extends, just studying what that could look like if that line extended into that geographic jurisdiction.
So do we need to add anything from your perspective to deal with the rail?
Because the study that currently exists that MDOT is doing at this moment does not consist of the rail component, that would need to be added, and that's why this bill would need to move forward if that's the posture of this respective body.
So Elliot Rosenberg is aware that the study didn't include rail, and yet that's still something he wanted to see happen?
I would have to check with Elliot Rosenberg, but I'm very, very sure, I feel confident saying that he was talking about the red line, actually. I should just let the elephant in the room is the
Right.
red line and that rail component of it.
Right, but this is all study.
Yep.
Okay. So again, just so I'm absolutely clear, it would require adding language at this point that they would take the affirmative action of looking at rail, in addition to all the other modes that they're already currently considering.
I would ask Matt to help in with that, but that's the gist that I've got from all the conversations that I've had.
So the conversation I had with them was that all options were still on the table, and there was concern over whether they were being required to only consider rail, because they seem to want to consider, there's both light rail and heavy rail, and then the bus rapid transit. They said this investment will be dedicated to the right-of-way. The mode of transportation is yet to be determined, but may be bus rapid transit, light rail, or heavy rail. And that's what they're currently doing. As I'm reading this bill, it does seem to lock them into rail. The definition of red line at the beginning seems to only contemplate vehicles operating in tandem on a fixed rail. Combination of at-grade elevated underground configurations. Yeah, so the bill as we have it, the posture that it's in, I think locks them into rail, so that it would sort of take bus off the table.
Yes.
And sort of question, but some having lived through this with the purple line. I mean, my impression, and Senator McCrae and others, and Senator Salling, who were from the region, can correct me, but my guess is the real deal here is that the folks who believe that rail is an important option fear that the administration's, the study will not take rail as seriously as it should be taken. And that was the essence of what I got from the bill hearing, is they want to be sure the rail is taken seriously as an option. And, I mean, I defer to the Baltimore area folks, but if they want, and if we want, I'm certainly supportive if the Baltimore area folks want it, to make sure the rail is not taken off the table in the study, I think we might want to amend the bill to just make that clear without limiting it to rail. That would be one way.
But rail is specifically defined in the bill.
As it exists now, yes. The red line, the definition of red line means a rail transit facility using one or more vehicles operating in tandem on a fixed rail.
Yeah, that's rail.
About as rail as it is.
But there are two options for rail here. There's light rail
Yeah.
and heavy rail. So there is some.
Let's get rail.
Senator Edwards.
Well, if I heard right, they're doing a study now, and there's $12 million in there to do the study for a corridor. Is that correct?
Correct.
So-
It looks like
so-
the study is all about the corridor and without designating what sort of mode of transportation is going to be along that corridor.
Well, I think a simple thing, other than if we don't do it, you're gonna waste $12 million if you specifically say they gotta study rail. You already got a study started. I think you just add, rail has to be part of what they're looking at.
I don't have the bill in front of me. But let me make this, let me just, yeah, probably, but, so is the rail component just within the city and not along the quote corridor? I mean, what is the distinction? The corridor doesn't mention rail, but the bill does mention rail? I mean, how does that, can you,
The,
am I,
the study, as I understand it right now, the study that's currently contemplated in the CTP
yes,
is all about the corridor agnostic to the mode of transportation.
I see.
This study required by the bill is specific as to mode of transportation.
Does the passage of this bill put something into the current study, required in the current study, or superseded, or
From what I-
will there be two studies going at the same time? I guess
So
that's part of,
From that was where I was a bit confused, is whether, the bill doesn't seem to contemplate that the existing study is taking place. It was almost like this bill came in without contemplating that study. So I'm not sure whether the studies merge and we have one study that is existing here,
Now we're
or are we influencing the existing study, or do we just have two studies running side by side?
On different tracks.
like
on different
two
tracks, different
trains
rails.
passing in the night. I'd like to pass this bill,
Okay.
but I wanted to make sense. And I wanted to make sense, so, I still haven't gotten the bill yet, but what's the money in the bill for this study?
So the money for this study is on page 4, and there would be, in fiscal years 2024 through 2027, the governor shall include in the annual budget bill an appropriation from the Transportation Trust Fund of $5 million. The appropriation's contingent on receiving federal funds.
Got it.
And that is to undertake the NEPA study, the environmental impact study that has to take place before any of this can get going.
How about we put in some language that says, to the extent possible, the existing study and this study should be coordinated as to minimize costs to the state, something like that, in terms of, and develop, and coordinating an overall plan, something along those lines?
Sure.
Look at me.
Anybody?
Yeah, I think so too. I think the main thing, I hadn't thought of the federal money until just now. I think a lot of the push for this is because the congressional delegation got attention to the red line and they
Right.
were put off the table. So I think giving direction on that is a very good idea.
Right. Okay, you got it?
Yeah, I'll add it as intent language in the back. and-
Yep.
And,
Yeah.
okay.
Yep.
Sounds good.
Recognize the existing study, bringing this money in, putting the money together, using it efficiently, all that wonderful stuff.
Folks want it?
Absolutely, let's do that too. Absolutely. All right, so as amended,
Favorable.
all those in favor?
Aye.
Opposed? Okay. Senator McCray. Surprise, surprise. All right. All right, let's do 617.
Okay, I believe you guys have a reprint on your desk for this one. It was not cross-filed, but it is, kind of falls in the category of that package you sent out for first responders and military veterans. This one deals with authorizing the localities to give a property tax credit to surviving spouses of a fallen service member if that surviving spouse is not eligible under an existing exemption. The reprint in front of you, just to stick with the spirit of what the work group did, in terms of allowing the localities to define who these people are, would do so, and then that's the only change in the amendment if you wanted to do that.
Well, if we do this, we certainly want to be consistent with what we're trying to accomplish with the property tax stuff. Everybody good with this? With it as amended? All those in favor?
Aye.
Opposed? Senator Jackson? You got it. Okay. So just a word on the gaming. We've had a bunch of discussions, trying to get to a good point. I think we're pretty close. A side issue has come up that I guess was an amendment that was asked for later, and I want to talk to the work group about it later. I think we're going to need another day on this, that has to do with the idea of, you know how you have so I don't know who's been to play bingo, live bingo before, but, so what's that? Committee party, yeah. I know, since we really haven't dealt with that issue, maybe this is the way to do it. Maybe it's the way to do it. But if you play live bingo, you know, you buy your cards and you put a dabber on them and things like that. Well, the trend has moved to that you can get a tablet that they have for you, and the card shows up on your tablet, and then you just touch the tablet so you can keep track of it all. And then another part of what has been live bingo for quite some time is these pull tab things that they sell you, and they come around the table and they sell you these things, and you rip them open and you win or you lose. And so there's the concept of putting that on a tablet too, so there isn't all this paper flying all over the place, and the need for all these pull tabs, but it would all also be on a tablet where you'd hit it and you'd say you won or you lost. You know, you pay for it in advance, and the tablets are all lined up. And of course, this it's not random. It's just same as the other program. It just would be on a tablet. So it turns out that some of our friends in the big O industry would like to be able to do that. But it also turns out there's some complications about the law, and Matt's been reviewing that, and we're trying to get to some sort of understanding of all that. So that's why, as it relates to the two bills, mine and Senator Jackson's, we're still in a little bit of a hold. See if we can solve this. Maybe it's a nice amenity that if we can come about providing it, we'll try to figure out how to do it in this bill as we adjust some of the big machines that are allowed. Okay, so that's that. Then, let's try to here's what I want to do, and so you understand where I want to go. These two bills, and they're completely, obviously, very different, 403 and 406. I want to see if we can try to get through 403 in a reasonable kind of way, and a useful way, altogether. My gut is that on 406, having spent a little time on it this afternoon with Philip, that I might want to break off some of us who are interested in working on it. It's important stuff. I mean, it really is. It's a very significant health concern for children in psychiatric care, and I really want to get it right. And the House has, put some time into it, but I really just want to get it right. So I might ask that some of us get together after this to try to really work through it. So that's where my head is on this. Let's start with 403 and see if we can get somewhere on that. It's been a long time since we talked about it, but I think we had a general feel that this fee, this $300 fee, particularly for new companies and smaller companies, is pretty significant. That I think we had a general understanding we'd like to do something about it. So let's get a quick refresher on that.
Sure, House Bill 403, I believe you guys do have a reprint on your desk. Last couple of weeks, the administration has submitted, I believe under Senator Eckert introduced it for them, an amendment on the bill. To start with the bill as introduced, what it did is for either the $300 fee or the $100 fee for reporting and recording the entity with SDAT, if that entity decided to file that electronically, then that fee would be waived. The amendment,
What was the $100 fee?
if you're a family farm,
Oh,
largely it's $300 for most entities. And so as introduced, the bill had fiscal note of climbing upward. Well, it started out at 41.4 in 23, but it would increase upwards of above 50 5 years out. The amendment offered doesn't change any of that. Instead, it just says that when any entity files a report with them, that they also need to submit a report including information about the Small Business Retirement Savings Board so that the board can determine if the person is in compliance with the Small Business Retirement Savings Program. The department and the Retirement Savings Board would cooperate in determining what information would be included in the report.
so I'm going to ask Senator Rosapep just to talk for a minute on this.
Yep.
Because we did this bill a couple years back. We want to encourage businesses to have retirement plans for their workers. And the carrot we gave them before was the elimination of this fee. And it's now taken a couple years, and I believe that this summer they'll be ready to kick this program off. So in essence, we've got this confluence of this idea of sort of getting rid of the fee because it may be too high, especially for smaller businesses, as juxtaposed to we were using it as a mechanism to encourage people to do something very good for their employees.
Thank you, Mr. Chairman. And thank the committee and predecessors of the committee who worked at this compromise. Senator Serafini and Senator Peters were the ones who really drove the train and worked out this compromise. Big picture is 50% of private sector employees in Maryland have no retirement savings plan at work. The whole point of it was to give them an option at work. Several other states have done it. Basically what it says is that we created the Maryland Saves Program, which is a nonprofit state-related entity, sort of like the college savings plan, where employers can sign up are required to sign up, but there's no penalty, which is how we ended up with this incentive, getting rid of the tax. And the employer has no responsibility to pay anything, just sign up their employees, and then employees have a couple of percentage points of their compensation deducted and put in the savings plan unless they opt out. So it's all worked out. It's a good plan. They've been working for a couple of years to set it up. They're ready to launch this summer. The fear that the board of the plan has, and Delegate Ben Brooks and I are members of the board, along with the treasurer and the Secretary of Labor and private sector members, is that as it launches, if the incentive isn't there, not enough folks will sign up. The state has loaned money to get it off the ground. So the more people we sign up faster, the better it is for everybody, plus it's better from the state point of view. The language that is in this amendment is language that I was involved with Maryland Saves and with the SDAT working on. It's great language. It makes a lot of sense. I remain concerned, and that's why I'd like a little time to think about this and talk to folks, that the way the mechanics of this might work is still not have enough incentive as it's getting off the ground. One of the suggestions that you and I had talked about, Mr. Chairman, was perhaps have a one-time tax credit to the employer in lieu of, if they're not going to pay the tax, but give them some incentive because we want them to actually move forward. So that's one option that we've thought about. The other that I need to put a little more thought into is I think many people here are concerned about folks who don't have any employees. And one of the problems is SDET does not have data on that. And so one way might be to say, when you file your report, you have to say whether you have employees or not. And if you don't have employees, boom, you're out, because it doesn't help Maryland Saves because they don't have employees. But for those who have employees, maybe say for the next year or so, it wouldn't go away. But then 2 years from now, it might go away. So I think there's some ways to make this work really, really well. So that's kind of where my thoughts on it.
Is that helpful?
Thank you, Mr. Chair. Well, three things. I would like to echo Senator Rosebach, your point about collecting data on who has no employees and who has employees. I think that would be helpful here. Erica, 2 questions. I have about 6 days before I can stop saying I'm new here. But how did we land on $300 to begin with? Anybody know?
I don't know. That greatly precedes my time.
It doesn't precede my time.
Okay.
It was like, when I was in the House, it was during one of the times we were trying to raise money to balance the budget and not have to cut stuff. And somebody came up with the idea of, well, this will spread the tax burden as opposed to raising other business taxes. And that's how it got in there.
Okay.
It was like, and then since then, people wanted to try to reduce it, get rid of it, and we're now at a point where we can do something about it.
Understood. Thank you. And then, Erica, do we have a breakdown of the 100 family farms versus the 300 rest?
Yes. I did get that. I wonder if I printed it out. Sometimes some of the categories are collapsed, so I don't, I have it somewhere. It might be in my email chain from gathering data on this.
I'd be
a while
interested
ago.
in seeing that. Mr. Chair, just a regular reminder, if we can do anything to help ease the burden on small family farms, I think we should do it. Thank you.
Unfortunately, I think we would probably need to pass something to get a fiscal revised on this. Maybe we can get some data, I don't know.
No, I mean, from the discussions that we had, a month ago, there's no data from SDAT, no matter which way you try and slice and dice and exclude and include people.
Yes.
This is whether people have employees or not. That's the question you're talking about.
Employees, size of business based on,
And I
income
get all
levels
that.
or anything.
But I guess where I'm going with this is, it's obviously much less if you are limiting it to the folks with no employees. And clearly, that's the clear policy issue. So I'm not sure how much is as important.
Do you think it would be as simple as maybe we say for the first 2 years of your signing up as a business, the fee is $50. And, I mean, we got, there's a lot, yeah, you know, and so, you know, presumably you're small then, presumably, you don't have employees, but that's not necessarily the case, but, and at least it kind of gives a little break to people coming on board at this point in time.
I don't quite understand it.
What don't you
I
understand?
don't understand. It would say who would pay 50 instead of what?
If you're a brand-new business.
New business, I missed the new
Yeah,
business
yeah,
part.
brand-new business.
So you'd have a category for new business, your new business,
Well, the first time, yeah, the first time
you
it's the
you
business.
only, you pay 50
Yeah,
if,
for the first 2 years, you pay 50, then you start paying 300. And maybe we figure this out later. I'm just not sure that we're gonna be able to figure this out completely in the next couple of days, and let alone get it across the street and get everybody to agree to it and all that. My gut is, though, that this is, my hope is that if we limit it to that, it would probably have a pretty small fiscal notice, particularly considering it's only new businesses coming on. It isn't gonna affect anybody who's already in business.
Except, Kim, can you get the mic, please? Except, we would have to talk to the department. I think I talked about them with them about this like a month ago. I don't think they have a way of distinguishing. If I'm switching from one type of entity to another type of entity, I might be flagged as a new business, even though I'm not. So, and I don't know that their system would have the capability, it would take staff, obviously, to research, you know, the history of the business entity. But it would, that amendment would capture that scenario as well.
Senator?
I'm just listening to this whole thing and just wondering if this is the time for that, or if we ought to do some work on it. I mean, life won't end if we don't pass this year, but it might be a great bill for next year after the work is done on it. Just a thought.
And I have an answer now to Senator Alford's question, whenever.
You have answer to Senator
Yeah.
Alford's question?
Senator Alford, I think your question was how many are family farms? For tax year 2021, they noted 787 number of entities.
How much?
787, yep.
That's not many. Senator Eckert?
Thank you very much. How much does it cost to run the Small Business Retirement Savings Program and Trust? Do we know? How much do we need to have in that?
I don't have the numbers off the top of my head, if I may, Mr. Chairman. But ballpark, for the startup costs, there are single-digit $1 million that has been put in to get the thing up and going. And I believe the projections are that if we get to the penetration rates that we're aiming to and getting to, they're able to pay back the state, I think, within 4 or 5 years. But it's several $1 million out then to get to the scale we need to pay the money back to the state. It's several.
But do we know how much the $300 a year amount is and how much the fund needs to see what the difference is? Because then we could figure out how much you could reduce the fee, because they should be getting their own money once they make their investment, right?
Right, but the fee is just in effect, being exempt for the fee is just an incentive for the businesses to take the trouble to sign their employees up. So they're sort of an independent path. It really doesn't matter how much it costs to operate the savings plan, because that's based on loans, and once the thing is up and operating, the management fees will come out of the operation itself. I don't have the more detailed numbers, I don't have it off the top of my head, but that's the scale.
Sounds like they need to be separated in some way. I would go for
Senator
reducing
Corrigan?
the fee.
So, you were talking about just new businesses going forward with the $50 thing, but unless I'm missing something, I apologize if I am. The intent of the bill wasn't it for the reoccurring $300 fee to all businesses, right? So what are we talking about on that end, or is this trying to figure out a way?
So that, what would apply would still be the existing program where if they engage in the retirement program, then
The 300 goes away.
the 300 goes away.
If you engage in the program?
That's correct.
Well,
Okay.
Yeah, I mean, look, here's the bottom line is that, and look, the reason we didn't do this from moment one, what was the fiscal note?
Oh, yeah, it's like-
at that point?
60 or 70 million.
60, right.
Yeah, it was
Right.
60, yeah.
So we're trying to acknowledge the fact that we've done something in this realm, and it's finally getting to a point where it'll be kicking in.
Yeah.
And trying to maybe do something little, that wouldn't
Break the bank.
break the bank, but send a message to people who are trying to start businesses that we understand the significance of the fee as it was, so,
So what you were talking about, it would just be a reduced fee the first couple years, and then if you join the program going forward, essentially you could not have any fee. Is that
you
correct
could,
to understand?
that would be correct,
Okay.
yeah, yeah. But look, I think, to Senator King's point, look, maybe I'm trying too hard on this, but,
Trying so hard to get this bill that's not ready.
I think the reason is because I think from the beginning, I think we would all acknowledge it's a statement we'd like to be making, I think, to our business community, that, so, and that's why I've been trying to find, in my own head, a way to make it useful and affordable. Look, we just did a major tax cut. The biggest, as the governor said, the biggest in the history of the state. So we have to keep all that in mind, and so I guess I'm gonna suggest maybe that we just hold on to this, and spend a little more time trying to figure it all out, and that's sometimes the best you can do, given the time that we have. Okay. All right, so, that leaves, 6:04, I mean, 4:06. Just, and I'm tempted to say, if you wanna work on this, hang out, if not, don't. But let's have one quick overview again.
Okay.
What are we trying to do here? What's the root problem that we're trying to solve, and, because it's significant.
So the issue of the bill is looking to address are circumstances where you have children, in the custody of Department of Human Services, so foster kids, other arrangements where they,
Is it only kids in that circumstance?
yes.
Only when they're being worked through the agency?
Right.
Okay.
Yeah. The note reference, there's a very small handful, it's like single digits that MDH had some connection with, but we're talking Department of Human Services here. Where kids are admitted to a hospital or an inpatient psych facility, and then, when they're stabilized, there's nowhere for them to be discharged to. So they're waiting for a placement, and what's happening is, I believe you heard from the testimony, some of these kids are staying in the ER, in the hospital, and in the facility for significant periods of time. And I think the intent of the bill is to try and address that issue. The bill would require the departments to pay for any stays that are beyond the hospitalization need. So the medical reason for them being there, when that's resolved and they're still there, the idea is for them to pay. The bill also modifies some of the procedures by which a judge could admit for psychiatric inpatient care. And I think that is where there are a lot of concerns in the testimony. I believe the judiciary and I think the Attorney General's office had raised some questions about issues with some of that language.
So as you all know, we're primary on this.
JPR is secondary.
JPR is second on that. Remember Senator Castley sat in, had quite a number of questions that day.
I remember that.
One other One other piece.
Which they will, I mean, assuming we move this bill, they're gonna, I should say when we move this, because I think we really should try to figure out a way to work this issue. But when we do, they're gonna take it up and they will, I talked to Senator Cassidy today, I talked to the chair of the committee today, and they recognize, some of the issues and they would work through all those, or do their best to work through them, but they've got some lifting in that regard.
There was a fund created in the bill. As introduced, there were some penalty provisions which were stricken, and those penalty provisions were going into this fund, which is, as written, going to be administered by Community Health Resources Commission. They submitted testimony asking to not be the administering entity for that. And I believe at the hearing, the sponsor testified that the fund may not even be necessary, given that those penalty provisions were stricken from the bill. The bill also.
So just, that's when I think we can solve, or at least in my mind, that we just do eliminate the part that, the commission being involved in that. We've asked them to do a lot of stuff over the last couple of years, and they're doing a great job on a lot, from health disparities to the consortium. But this is kind of out of their realm. So I think that would be one thing that we can maybe agree to. Okay, you can keep going, Philip, sorry.
Is there a different entity you wanted to?
I don't think I mean, if it's not, if we don't have the fund, right,
You mean strike the fund?
as the sponsor has suggested, right?
Right, so strike the fund.
Right, and then that strikes the need for the commission to be involved.
Okay.
Okay?
The bill also establishes, starts on page 10 of the bill, the third reader, there establishes a task force to examine the placement of foster children in emergency departments. Fairly long list of representative stakeholders with a charge to examine the placement of foster children in hospital emergency departments and other issues related to the out-of-home setting placements. Focusing on children with disabilities, review of the current shortages of appropriate placement settings, collect and review data regarding placements in hospitals, emergency facilities, and inpatient facilities, and then make recommendations on a plan to respond.
So this bill has this group studying what to do about all this, even though the bill is trying to do something about it from the get-go.
Correct.
And so the bill, in part, is ensuring that when a child is in one of these facilities beyond medically necessary, that the hospital still gets paid. That's one thing, correct?
Correct.
And who pays that bill?
It would be the department that's responsible for the child, so largely it's gonna be human services. So that's an issue that I followed up with the departments, and the language in the bill specifies prevailing Medicaid rates, and they're actually unclear what that terminology refers to. So that's a piece that they've flagged would need to be clarified. Yes.
Can we? I mean, do you have a suggestion of how we do that?
I think that's one where we can figure out a way to word that so everyone is comfortable. It's just that particular terminology,
Okay,
I was told, does not tell them what to do.
okay.
There was also a concern raised with regard to language on page 7 at the top. And so there's a provision that if a hospital or emergency facility or an inpatient facility is required to extend the admission of the child due to the inability to find suitable placement, This provision specifies that those facilities may not be held liable for violating the requirements of the Federal Emergency Medical Treatment and Labor Act. And that's federal law that basically requires when you go to an emergency room, they're supposed to take a look at you, see if there's anything wrong. The concern, as it was explained to me, was you had a situation where a child's in a facility, they stabilize, and then while they're waiting for a placement, their condition exacerbates or something else happens. There's concern that this language is somehow creating an exemption from that federal requirement to then re-engage with the child.
Do we have any ability even to get around, I mean, how do we get around a federal requirement like that?
Well, this is providing it says may not be held liable. I assume that would be applicable only to a state suit. I guess they could still file it on the federal level, but this language was flagged as a concern as creating confusion at least.
Senator Jackson?
Mr. Chairman, thank you. So I have a concern as well. So if we're trying to resolve this, and I guess on one end, once I'm medically released, the child is medically released, and then we have this entity that's supposed to be studying this to ensure that what are they studying? They're studying to ensure that these lapses don't occur, or that
Yeah.
trying to resolve the issue. So I was brought in from a facility because I needed some care. Once that care has been rendered, I'm released and they're not coming back to pick me up.
Right, because there's nowhere to put you.
Right.
And
so,
within, I mean, there's no placement available for outside the medical environment.
right, outside the medical environment. But what I mean is, but I was brought in.
Right.
And so the folks who brought me in are not going to come back and pick me up.
I think that's basically
That's
what's
That's what
happening. Yeah.
occurred. And so, but we have the entity who's studying this matter. But then there's, almost to me, it seems as if there's like an out that says you may hold someone liable. Right?
So there is, well, the page 7 provision, it's a very specific set of circumstances where the concern arises there. So it's concern as to whether it's, and I don't know to what extent it would actually play out. I don't know that a hospital, if they had a child and they were discharged, but they couldn't go anywhere, and then they had to, respond to something that exacerbated or something new that came up, that they wouldn't treat them. I would think that wouldn't happen.
No,
But it says may not be held liable for violating the requirements. So I think the concern of this language is that it opens the door where maybe they were providing care, but the care was negligent somehow, and it's shielding liability in that sense.
I think it's kind of confusing to me, and I'll get off of this, but, the hospitals can't refuse healthcare to anybody, whether you're indigent, whether, whatever, so, and if there's care needed, then that's one piece. I just think, once the care is rendered, the hospital has done, or the medical facility has done what it needs to do. My concern is, I think the bill is trying to do a couple of things here. My concern is, healthcare providers are trying to ensure that they're not blamed for housing of these young folks. We're trying to make sure the young folks aren't left there for them to get hurt at the facility, cause some challenges there, particularly if there's some behavioral health issues going on. And I think, I guess all I like to say is, I mean, I've heard this for a couple of years, when I was on the other side. I don't know where we go with this, but I think to alleviate blame on someone is really not enough for us not to kind of try to get to the crux of it. I don't know if you understand what I mean, but I'm thinking this need is so great that we need to do something. And I think that the care portion of it, I think it takes care of itself because of where they are. The challenge is someone's not picking these young people back up. They can no longer place these folks somewhere. So where is the crux of the resources folks? Are they a part of this group that's trying to determine why this is occurring? Because I don't like the notion that just because I can't send you out of state,
Right.
I can't find anywhere else for you to go.
Right.
That's, you're talking about human beings here, and I don't think we're better than that. So, certainly don't know the answer to it, but, I'm not interested in someone who has the authority or the responsibility to take care of folks to ensure they have a way out either, so.
So
That's
one
just-
thing.
That's my editorial,
Yeah,
sorry.
one thing the bill also does on page 7, subsections F and G, so whenever a child's moved to one of these, hospital inpatient or emergency settings, there's a requirement that the local department notify the Office of Public Defender's Mental Health Division. The reason for this is so that the Office of Public Defender then is on notice of a child in, a situation where they potentially need the services of the Public Defender's Office. And then the bill also establishes a requirement that the governor appoint somebody to coordinate between Department of Health, Human Services, local departments, and the courts in carrying out the provisions as enacted in this act.
Isn't that part of the new Governor's Office of Youth, of, crime prevention and, I get it mixed up, it used to be GOCAP.
Yeah, yeah.
I remember when the Office of
GOCAP.
Children came under them, yeah. And so isn't that, are they the entity that's assigned through this bill, or?
It just says the governor shall appoint an individual to coordinate. It doesn't say, specify, within a particular governmental unit.
I mean,
It
I
makes
know
sense, it's that.
Yeah,
It would.
because I know that for a while, we had that tweener stage where our young people, before they're emancipated, they found themselves in a crux. So, anyway, all right, thank you.
So-
And the bill also requires the Department of Health or Human Services to provide the beds necessary to accommodate the children requiring the medical admission or treatment, and to ensure the least restrictive placement. Again, I think,
So.
The issue is that there's no space.
Well, zero in on that.
yeah,
It's whose responsibility?
the Department of Health or Human Services, so I think largely it's
To
gonna fall
provide the
on
beds.
necessary to accommodate the children requiring medical admission or treatment.
So I
And-
believe that part of what we did with in the budget was put in $35 million for additional beds, if I'm not mistaken. At the very end, we added that, I know I'm not mistaken. We added at the very end, and I wonder if we can tie that in somehow. Philip, that's one thing, let's look at that money.
Okay.
I'm pretty sure it was designated, I don't know if it was designated for just youth, but it was behavioral health, but this may be a good way to link that into this, but, because there's no specific money in this bill, correct?
I don't believe so, no.
Especially if we take out the fund, right, the fees. So to ensure that there are the beds, which we're telling the departments they have to do it, correct?
Right, and actually to backtrack, I mean, there's no mandated amount or anything that the fiscal note does reference that general fund expenditures may increase significantly to comply with the bill's requirements. So, I think that piece about providing the beds would fall into that category in
Yeah,
addition to other.
let's look into seeing if we can link that money we just provided, if that would fit with this. Senator Zucker?
Thank you, Mr. Chairman. No, it's interesting, as I haven't really spoken on this, but it is a real issue. I mean, we had a youth in one of our hospitals in Montgomery County, and I was getting calls from the president saying we cannot get the child out. We just can't. They're ready to get out, but we can't get the child out because there's no space for them. So, I mean, I just think there's two fundamental things as we work through this. One is, Department of Human, I mean, they're in custody of the state, they need to provide beds. And if they're not providing beds and they're stuck these children are stuck at the hospital, then the state should be reimbursing the hospital for having them stay there. I mean, it just, for me, it just sort of as a public servant, it's unfathomable that you have a child who is in a restrictive environment in the hospital. They are not necessarily trained to deal with this certain population, and there's no space available for them at, I mean, I know there's one situation in my area where there was space available. The person came down with COVID, so they couldn't leave the hospital, and by the time they were gonna leave the hospital, there was no space available in the place they were gonna be placed at. So it's just, I think fundamentally, we need to kind of get our heads together around this. I think, obviously, there's a capacity issue with beds, and I think, Mr. Chairman, that's what you're talking about with the funding piece through the budget. And then there's also, you know, look, if the state's not able to provide beds, then they should be making sure that the hospital isn't, look, it's all of our responsibility, we're a community, but you're having the hospital have them as residents in the hospital as almost a long-term facility, and then they're the ones paying for it because often the families or this person is now on their own and they're wards of the state. So it is an issue that I think we have to get resolved this session, and I know we will.
So, just to follow on with that, Philip, so the bill already says that payment needs to be made by the departments for the time in the hospital.
Yeah.
So that's that.
That's page 6,
The other
lines
part-
26 through 31.
So the other part is this idea of whether or not they actually have enough beds. And it kind of, since there's no money in the bill, it's kind of, it's almost a little bit of a leap of faith. And that's why let's look into the funding source. Are there other things that cost associated with this bill?
So the bill requires, when a child is evaluated, it requires the Department of Health or Human Services to begin placement planning for a child. So when they go to the facility, the bill requires them to start planning for that child to, when they're discharged, to go somewhere.
But isn't that something that should automatically be done, but
Well-
under current situation and current budget within the departments?
I don't know the answer to that. I would assume so, but
Right,
it's clearly
right.
not happening, so.
Right, right.
And so I think there are costs attributed to additional staff,
Okay,
related to those activities.
okay. Anything else?
I think the cost is gonna be staff, but the fiscal note didn't get any information, about the fiscal impact from human services. And so, for illustrative purposes, the fiscal note points out that every additional caseworker, state expenditures increased by 80,000. So, and then, an MDH caseworker, it's 96,000. Again, I think the bulk of it would fall to DHS, because they're the ones that have almost all of the custody.
Do you have a daily population on this?
Right, that was my question, sure.
I can check with the departments, I don't know.
All right, that's the second piece of information we need.
Absolutely.
Senator Quarterman.
No, thank you, Mr. Chair, and I bet, you know, yourself and Senator Zucker couldn't agree with you guys anymore. But I think it comes down to what you just hit on there, the population. I mean, how many people are we talking about? How many beds do we need? Where do they need to be? What the staffing is? I mean, it's that, to me, that's the unknown. So if we can figure that out, I think, you know, then we can move forward on it, but I don't know how you find that information. I think that's the biggest thing. I think everyone agrees we need to move on, but if we got no place to move them, we don't know who they are or where they're moving, that's extremely challenging.
You have an answer to that?
The start of an answer, Mr. Chairman, I think. Phil, jump in here to help me, but I'm looking at the fiscal note. It looks at, in the calendar year 2020, there was a total of 84 youth reported to have an overstay in the hospital, with psychiatric overstays being 280, overstays when they can't get placement. and overstays of 171 days. So be interested to see if they have anything for 2021 yet.
Senator Elfreth?
Thank you, Mr. Chair. I don't mean to be a broken record, but I think we're, to your point, we're getting to the foundation of the problem here. And I want to make sure I understand, are we talking about, is a Shepherd Pratt the appropriate place if they had beds? Is that where we need to wrap our heads around? Or what is the answer? What kind of bed or facility do they need? And then backwards work how many beds, more beds we need depending on how many kids we're not serving properly.
I think part of the complication is it depends on the need. So, if it's a psychiatric admission, then discharge to, just the child's foster home may not be the appropriate discharge setting. And so I think, it's the whole, up and down the whole gamut. So, I mean, if it's, a physical injury, obviously there's not that, I don't think there's that complication, but I think it's across the board. It's all placements that, and I think some of the more intensive placements, I think, are a little more,
Are the more challenging?
yeah.
Okay, so it's absolutely nuanced, and we need to get a better understanding of the nuance in addition to the raw numbers and bed capacity and all that. Thank you.
Senator Roosevelt?
Thank you. I agree with everything that's been said and everything that's been asked, and it is really helpful. So it sounds like there are hundreds of people in this situation, is kind of the big picture. I'm sure it vacillates from year to year. What I don't understand is, and this goes to what Senator Elfreth is asking, I guess, but if anybody had any sense of this, where did these people mostly live before they went into the hospital? Was there anything in the testimony or anything that, are they mostly coming from,
They're foster kids.
for
right?
foster kids? Is that what it is?
They're all foster.
Oh, they're all foster kids.
That's accurate, correct, Philip?
I believe so, yeah.
Well, again, this is why I don't understand the system that well, but by definition, foster parents have sort of the responsibility for the kid. I mean, that's what they're taking on when they become foster parents. There's got to be two categories of folks who go into the hospital from foster parents for some crisis problem. Presumably, in some material number of cases, they ought to be able to go back to the foster parents. In some material cases, they can't go back to the foster parents. Is that the way to think about this?
Well, I mean, some are coming from, residential treatment centers. So, I mean, some information I have from DHS, in some of these cases, you're talking children with severe, either psychiatric or other medically fragile conditions.
Right.
So I don't know what the full spectrum of the.
Okay, I guess the reason I'm asking that, it seems to me a lot of the discussion hadn't focused on the folks who have the primary responsibility for the well-being of the kid, which is either the foster parent or the institution. And there clearly got to be kids who should not go back to where they were. I'm not clear, is that like 90% of the issue, or?
I don't know.
You
I
don't
don't know.
know.
I don't know what the breakdown of the.
Okay.
I mean,
Source
I'm gonna
placement.
guess that it's a combination of things,
Right.
because sometimes what is needed is continued inpatient.
Yeah,
And then there are many other times where they just need community supports, outpatient clinics and things like that, and, I mean, that's a whole nother.
And a further complication, I think in some of the testimony, there were examples of, a child was in a placement and suffered abuse in the placement, and so then had to go to the hospital, and so obviously they're not gonna return the child to that original placement.
well, let me ask you this question. So is, the basic issue is how the money flows and how many places there are for people to go when they get out of the hospital? Is that the basic, those are the two basic issues?
Yeah, but it seems the crux of the problem is that there's not enough spots, which need additional
the problem.
providers, need additional beds.
Okay, so in that case, what you all have been suggesting seems to me to make sense, is we ought to do something about the flow of money. So if they're in the hospital, need to stay in the hospital's getting money to take care of them. The hospital should be incentivized to take good care of them if they got no place else to go. I mean, I think that's pretty obvious.
Yeah, that's in the bill, I think
Yeah.
that one's clear, that one's a done.
Got to clear the
That's a done-
definition of appropriate Medicaid.
That's a done deal. I will say that the the health department very much wants an amendment put on, that I believe we have, that helps them understand early on where the admissions.
Status of the kid.
Right.
Got it, makes sense.
Therefore, their point is that then they are then able to prepare for
Yep.
the potentiality of
Yep.
extended stay.
Well, that makes a lot of sense.
And I presume that we would do that for both departments in that regard, providing that information. And I'm sure that that's a little complicated there for the hospitals to keep all in additional track. There's a lot of registry stuff going on nowadays, trying to have some sense of what is really going on in the behavioral health world. But it's the kind of thing we ultimately have to really get, I think, better at to be able to know how, whether or not we're actually providing the services we need to provide. So I think we want to do that. But yes, in the grand sense, probably just not enough spaces.
Right, but that goes to your $35 million.
It does go to the 35
So
million.
where I was going with this, it seems to me like we got a path forward.
We may. The only thing I don't remember specifically is, and I don't think it probably was, as I recall, that detailed in defining where exactly it went to.
We can figure that out.
We can try to figure that out, yep. That's certainly job one. Senator Griffith.
Thank you, Mr. Chairman. It seems to me that, first of all, we've got a real problem that's been identified, and I think some of the questions that we're raising, the answers don't exist, which is why the bill considered a task force to kind of peel back some of the layers for this. And so it seems to me like a path forward might be to look at the short-term issue, which is those that are, these real-time issues that are arising, and how to make sure that they get addressed and communication happens with the respective agencies, and we have a sense of what the bed availability is real-time now. And then there's a longer-term process that involves the task force, which, for me, when I looked at all the questions in the bill and the fiscal note that the task force is charged with answering, I'm surprised that the report would be due December 2022, because I think it may be a little more complicated, an issue requiring a little deeper dive and a little longer-term exploration of the issues. But for these most vulnerable youth, it just seems to me like the immediate need is where those that are staying overstaying in a more restrictive environment could find placement. That seems like the short term. And then the longer term is where the task force can take us in terms of coming up with long-term plans. So I don't know if there's a path to get, in this bill, if there's a path to take care of those two routes, but that's what it seems like to me.
I think you're right. I think I think my gut is there is a path. I feel it. I feel it. We're going to get there. Senator Eckert.
Yes, thank you very much. I think it is a capacity issue, and I think it's along the continuum. If you recall, over the years, we have kind of closed our residential treatment centers. We've downsized group homes because it was determined that kids were best in the community in a home. But the problem is we don't have enough families to be able to manage the complex care that many of these kids require. In addition to that, I know on the shore, we had a residential treatment center, we had 2 psych centers, we had Upper Shore. None of those are available right now. So it's created a real dilemma. On top of that, our local management boards, of which we all have one in our community, are responsible for working with kids at risk, and I would think they probably have some information about that. The other piece of information is that we did have Office of Children, the Children's Council, which comprises of all of the department secretaries and/or their designate that really should be coming up with the resolution to this. So I'm just offering that it is a problem. It's been a problem for longer than, probably for several years now, and it's only getting worse. And I think the department needs to be challenged to either put it in their master facilities plan, which is way too far down the road, but to come up with a plan on, how, placement for the kids. And/or a short-term fix would be to deal with or offset the cost in the facilities while there is a plan that's proposed.
Senator Salling?
Thank you, Mr. Chair. Just going on with the good Senator, Senator Craig Zucker, reading about the overstays and the total numbers, and you just think about just 84, but then you think about altogether how many that were there and how many, that needed really the help. And it speaks specifically the different types of help, how some of them are specialized medical. They said there's certain kinds of appropriate facilities, which is kind of obvious now they don't have enough facilities. And it's obvious that with all the numbers of the weights, and do we even know all the facilities that are in-state and out-of-state? Like, that's a big question. And if knowing of all the facilities that are in-state and out-state, what's available there, what we need to do more for them, and finding out the availability of maybe more in-state facilities that would help and maybe accomplish some of the numbers of the overstays. And, again, it says high-level care, specialized placement. I guess they're very specific at each part. So I don't know if we're answering the call for specific things that are in here in the bill. That's probably the biggest problem. How can they place certain specific types and they don't have the availability maybe of some of them, and that's why some of them are going out of state. Hope it makes sense.
Is there something that you all want me to say? My light just went on unilaterally. But I'm happy to add whatever. Yeah, I mean, look, I think the issue is that a lot of these individuals need specialty care, and they just don't have the space available, and they just are in a holding pattern until there's a space open, but they're in the hospital until that, and that could be, a month, 2 months. I still don't know if the person has moved out of the hospital in our local area, and that's been since December, January.
Information that members of the committee think we should get on this? Yes, I'm sorry, Senator Griffith, I didn't see you.
Yeah, I guess I would just add, I think we all have to keep in mind these kids they're the state's children. They're our responsibility. And so while, under ideal circumstances, there would be a number of equipped foster homes ready to receive these very complicated cases, there just aren't. Otherwise, they'd be placing them there. So the responsibility lies with us to find a solution. And like I said, it's probably a combination of several of the things that have been mentioned here, from making sure that those who are taking care of our kids get fairly compensated for that care, but also making sure that we understand the safety and health and well-being of those youngsters is not keeping them in inpatient facilities when they don't need to be there. So, isn't that so?
Amen.
I think that's so. So I want to chip away at a couple more of the things that you've mentioned earlier. The liability issue seems to be problematic. Somebody put that in there, I'm sure, for a very specific reason, but it doesn't feel right. Taking away liability just doesn't feel like the right thing to be doing. Everyone kind of agree with that? All right, so we may have to address that. What other you had a couple sticking points in there about language.
Yeah, so on page 6, there, in lines 22 through 25, there's a provision that says, the departments may be subject to administrative or legal procedures available to an aggrieved party for failure to provide a child admission or treatment required under this section. It just jumped out at me as the bill seems to be about not having them in certain settings. I think this language might need to be refined. I'm not sure. It seems as if this language is meant to be directed at not being provided admission or treatment in an appropriate setting, not meaning the hospital, but the language, it seems a bit unclear on its face to me. So I think that's probably something that we should look at. And then on page 5, lines 24 and 25, maybe additional sets of eyes, but I haven't been able to wrap my head around this paragraph 1, which seems to be indicating there's a requirement that the departments provide information to a hospital or facility about any attempted hospitalization or hospitalization within the previous 77 calendar days where the child was released. Now, paragraph 2 says a medical determination that the child did not require hospitalization. I think that one's pretty clear. Paragraph 1 says the child was released due to the inability of the requesting department to find another suitable placement for the child. And I'm not sure.
Doesn't sound like the best reason.
It seems like it's saying the child was released because there was nowhere to place them. That's how I'm reading this, and I don't know if there was another intent or if there's something that needs to be clarified or if it needs to be stricken.
Which doesn't quite feel right. I don't think.
But paragraph 2 seems consistent with the intent of the bill. That the issue is that there's no medical reason for the child to be in the setting where they're in. I think that one's fairly clear. It's just the paragraph 1 seems. I can't wrap my head around that one.
Just so you know, on that 35 million, the language is this. To provide funds to expand capacity for individuals experiencing mental health crisis, including 23-hour crisis beds for outpatient mental health care clinics and step-down beds from inpatient psychiatric units.
Pretty good.
Could be good.
Who writes this?
Could be good. So let's see if we can maybe link these two together. Senator.
I have one more question. Do each of these kids have some case manager with health department? Well, no, I don't know. That's my question. I mean, in all this conversation, and partly with Senator Cassidy's questions about the judges and this and that, I mean, and I take the point about foster care and not all foster care, but there has to be some adult, I guess, in the agency who is responsible for that kid.
Yeah, I don't see how they'd be in the system without having been assigned to
It
somebody.
just seems to me the role of that person is kind of critical to the coordination function here, and I haven't heard much discussion about it. I don't know what the issue. There's nothing they can do?
Kid has been taken to the facility and they haven't come back. The responsible folks have not come back to get the kid. Hospital notifies them, Mike Jackson is ready to be picked up. They
I
never come
understand.
back to get Mike Jackson.
But that's really my question, though. Is that case manager responsible for figuring this out? Are they the ones who say, I gotta find a place for the kid?
That's part of the crux of what we're trying to do, to find a responsibility. I mean,
Right, that's why I'm asking the question, because I don't understand how it works.
yeah, folks have been trying to.
Senator Zucker has.
Senator Zucker.
Yeah, my understanding is, so you have the child, to the Department of Human Services, they're notified by the hospital that the child is ready for discharge, and then that case manager with whatever county is working with other organizations or institutions that I won't name, I won't name individual institutions, but those that care for this type of population, and they're finding out if there's beds available. And the issue comes in when they're like, there's no beds right now available, we'll put them on the list. And while they're waiting, they're in the hospital.
Yeah, I understand.
So it's more of a function of, you do have the case manager on it, or whoever the social worker is, or
Right,
whoever.
so this,
It's just, yeah.
the focus of responsibility, thank you, that was all.
Court-involved cases are different.
Well, that's what confused me, yeah. Okay, thank you. I don't install it today.
Well, first off, I want to thank you all for hanging out for this. I think it speaks volumes about how important this is. Does anybody have any other questions? Because this is how I think we wrap up for today. That we, I want to come back. I hope Philip can handle this. You can tell me if I'm crazy in a minute. But I'd like to come back tomorrow morning at 9, because I'd like to do it in the morning, get this done, and move on to the next committee, because that's our biggest problem, is time too, along here. So if we can come up with a couple of these things solved, or at least in a place that we feel more comfortable with, I'd like to come in at 9 and do this. You okay with that?
We do 9:30?
Well, knowing that we're going to be on the floor at 10.
I'll do my best. I don't know if that's.
Yeah, I understand. This is not easy, time-wise. I agree, I understand. And you may not be able to get people in the next 45 minutes, if they're even there for 45 minutes. I understand. Senator Eckert?
Thank you very much. I can lighten the load
Okay.
and deal with HB 1208, the health occupations bill.
Yeah.
If you want to lighten it. If we've adopted, I reviewed the bill, I've reviewed all the information, and with the amendments, I was operating from the original bill. With the amendments, it defines preceptorship pretty clearly. I believe the recommendations from the Maryland Board of Nursing have already been incorporated into the bill. Is that correct, Philip?
There were two pieces, those pieces we talked about, the didactic versus all aspects, and then the piece about the 14-day training facility approval.
That's already in the bill.
Those are amendments the Board of Nursing submitted testimony to you all at the Senate, for the Senate hearing, that they would like changed. So those are changes they're requesting in its current form.
Okay, as I read the reprint, it was in there.
It's in there, they don't want it in there.
Okay,
They propose striking, I think.
Is that more of a question?
whatever those changes are, if you adopt those changes, I think that will take care of it. The most
Is
recent
that a
letter.
question, I mean, remember, this is going to EHE next.
Yeah,
I mean, is that a better question for them to handle?
well, that's true. They could go ahead and handle that too.
So you would be good
Yeah,
with
If
the
they're
bill
gonna
as it
do that.
is, and let them deal
Sure.
with those issues?
sure.
So the idea is then you all were both favorable, expecting EHE to possibly amend it, for then you all to revote.
Yeah,
I don't want to revote. Oh, I guess right, we'd have to revote.
yeah, I just have a copy of the amendments too that were sent to me.
We can do that off the floor, though,
Yeah,
So moved.
okay? All's in favor?
I,
Opposed? Okay, so we got a plan for that.
I do have two bills you're secondary on that we got from finance.
Just now?
thank you.
Yeah.
Okay.
One of them.
Last week.
One of them will be fairly easy. House Bill 1370. It's the organ and tissue donation bill. It's not cross-filed, but it's identical to Senate Bill 574. It ended up being finance primary, you all secondary. It's the same bill. They voted it favorable. Senate Bill 574 is already fully passed.
Okay, all those in favor? Aye. Opposed? Okay,
The other bill is House Bill 588. Finance was also primary on this. There was no cross-file. The bill would set up a pilot program for 3 community action agencies to work with local health departments to provide feminine hygiene products. It sunsets after 5 years, and there's language for fiscal years 24, 25, and 26 for the governor to include funding in the budget, but it's not considered a mandate.
okay,
And
All
the affected counties would be, or the counties that it would be focused in Calvert, Charles, St. Mary's, Prince George's, and Baltimore. Baltimore County, not city.
all those in favor?
Aye.
Opposed? Okay. Yes.
Since 8:55 has to also go through EHE, I would let it go ahead and go today in the interest of getting it done before.
8:55.
That is the ag grant bill,
Okay,
because it's got another stop along its journey. I know, I'm a big softie.
Favorable.
all those in favor?
Aye.
Opposed?
And I may or may not have heard from the House Rules Chair.
Very good. Okay. So we're gonna try. Let's see, tomorrow. So Wednesday, Thursday.
For that one bill, you're talking about the mental health bill?
Yeah, I'm trying to do the timing of it. What?
Had a big discussion about it.
I tell you what, we'll not drive everybody crazy. We'll wait until, we'll meet right after session. We won't have as big a lunch as I gave you today. It'll just have to be a quick lunch. So we'll move quickly off the floor to do that. And I'm hoping that we also resolve the gaming thing. And then we should be in pretty darn good shape. If we get those 2 items handled tomorrow. Morning's free.
Time for an early Anne Arundel County delegation meeting.
Well, that's how you get out of being chair. That's a strategy right there. All right, okay, so we'll see you on the floor, and we'll meet right after session
Great.
to hopefully knock out these 2 issues. All right, thank you all very much. Have a great night.